Welcome to Module 5, Secondary and Vicarious Trauma, Countertransference, and Professional Self-Care. Professionals who work with bereaved patients are likely to experience their own anxieties about anger and guilt, sadness and despair, and especially with their own conflicts around death and dying. The work of helping and providing emotional support requires one to open their hearts and their minds. Yet this very process of empathy is what makes nurses, doulas, midwives, psychologists vulnerable to being profoundly affected and even possibly traumatized by their work. When we have witnessed a traumatic event, we may develop secondary or vicarious trauma symptoms. Here is a list of those symptoms and how they may manifest in your life. How you respond to witnessing a traumatic event in your patient will be very different from how your coworker will respond emotionally. It all depends on who you are as a person, how long you've been working in this area, what is your personality and temperament, what's your trauma history, what are your personal life circumstances, what are your coping styles, and how do you take care of yourself when you work in these settings where you will be witnessing and working with people who experience trauma. We are not immune to our own pain in our lives, and we bring that into our work. So becoming really conscious and self-aware of how our work affects us is really beneficial in the work that you do and making sure that you take care of yourself. I wanted to say a little bit about countertransference. Countertransference is really a word thrown around in psychology, but I think it's applicable to this presentation because as healthcare providers, countertransference comes into play. Countertransference is complicated because as a clinician, I could be responding or not responding to my patient based on unconscious or conscious thoughts and reactions to my patient's story, circumstances, and or trauma. Many, if not all, nurses, caregivers, doulas, midwives, doctors, etc., grieve when a baby dies. In fact, most healthcare providers experience grief, sometimes profound grief. Typically, when our society thinks about healthcare providers and grief, they often associate death in a hospital setting with emergency or critical care, oncology, or palliative care, not perinatal or neonatal care. What are your thoughts about showing emotion in the room with a grieving family? Is it professional? Is it human? Of course it's human. Just because you cry doesn't mean you're not professional. You are bearing witness to a profoundly human experience of tragedy, grief, loss, and trauma. It only becomes problematic when the family feels like they need to take care of you in the room. If you're feeling overwhelmed with a situation, it's okay to excuse yourself and seek support and coverage. Caring for families with perinatal or neonatal loss changes you professionally and personally. Do you take your grief home? Of course you do. What matters is how are you taking care of yourself and communicating your needs and or experiences with your colleagues and your family. In fact, most nurses identified colleagues as their main source of support. Having a safe place in their workplace to share their feelings was incredibly helpful to process the possible vicarious trauma and sadness for the death of a baby or babies. When a healthcare practitioner's grief is acknowledged, the nurses may feel better supported, which can ultimately lead to enhanced nursing practices and quality of care for the bereaved families in the future, as well as enhanced quality of work and home life for the healthcare provider. The broad definition of countertransference includes all your thoughts and feelings, judgments, and reactions that you'll have towards your patient. The narrow definition includes personalizing the thoughts and feelings your patient has. For example, a patient may discuss her depression and sadness around her relationship with her mom and may consciously or unconsciously remind you, the healthcare provider, of a similar relationship with your mother, and you begin to have feelings that interfere with your ability to stay present emotionally for your patient. You might also change the subject. You might also point out that the glass is half full instead of half empty, trying to cheer the patient up, sharing your own personal experiences of loss. Sometimes it's appropriate, sometimes it's not. And again, if the family, has to start taking care of you, that's a sign that you need to excuse yourself. So what can you do to take care of yourself? As that picture right there says on the slide, you can't pour from an empty cup. You must take care of yourself first. It's a necessity. It's not an option. So making healthy lifestyle changes, making sure you eat during the day, clarifying your personal boundaries, identify what you need to reduce stress in your life. Be compassionate with yourself. Find humor in your day. Laughing is really good for us, our soul, to release endorphins, break up the stress, anxiety that we might be feeling on a daily basis. And just having the personal awareness of warning signs, emotional triggers, maybe you feel things in your body. Just being really present is important. So finding those things in your day that restore and or relax you. There's a great app that you can get on your phone called Insight Timer. Like to have insight into something. And this app offers guided meditations from 1 minute to 3 minutes to 5 minutes to 10 minutes and up. And what's nice is that you can control how long, you listen to something. And you can lay down. You don't need to be in lotus position. You can even go for a walk around the block while you listen to it. And there's so many so many different ones to choose from that help promote a feeling of well-being and calm and safety and heart-centeredness and self-compassion. To a guided meditation on there that might help you sleep at night. So I'd like to offer that as an idea to help yourself during the day or in the evenings with self-care. So we must meet our own mental, physical, and emotional and spiritual needs. We need to give care from a place of abundance, not scarcity or exhaustion. Personal healthy changes. Here's some ideas, again, to help you take care of yourself and your needs during your workday. Learning to use the word no and mean it. Breathe deeply, slowly, as often as possible. That helps ground you and connect you with your body. Sharing your workload with others is important. So these are just suggestions. I'd like you to think of 1 or 3 things you will commit to do starting tomorrow to take care of yourself. Thank you. Thank you for watching this program, this presentation. If you need anything, have any questions, want to reach out and talk to me about anything, if I can support you in any way, this is my information. I'd be happy to answer any questions that you have. There are a few more slides I'm going to go through, some very important resources that you might find helpful in your work. This is the Pregnancy Loss and Infant Death Directory. It provides resources globally for infertility, terminations, pregnancy loss, stillbirth, and infant death. I created this with Kylie Hanish. We offer resources on counseling and psychiatry, acupuncturists, support groups and organizations, remembrance items, and healing projects. You can order our hospital cards, which are really helpful for making decisions after someone has found out their baby has died in utero, is stillborn, or will die shortly after birth. They come in 3 languages, English, Spanish, and French. We also have a Get the Facts section on our site for statistics, normal grief reactions, PTSD, pregnancy after loss, living without a rainbow, and suggestions for family and friends and how to support a loved one or friend who is grieving. If you or someone you know would like to be listed on this directory, please email me at drivylove@gmail.com. This is a short example of the list of resources we offer on the Pregnancy Loss and Infant Death Directory. So as you can see, it will be listed by area around the world. This is the United States, and then it will list organizations, for example here, that support families who have experienced pregnancy loss. This movie, called Return to Zero, maybe some of you have heard of it, is a movie about Kylie and Sean Hanish's story of their stillbirth, and it is available online. Sean Hanish wrote and directed this incredible movie of loss and hope that has helped women and their families all over the world. Kylie asked me to help her develop a program for her Return to Zero healing retreats, and I have co-facilitated many beautiful healing retreats with her for the past few years. When developing the retreat format, I incorporated rituals such as smudging, candle lighting for each baby who has died, a memory table where the women bring a few items and photos to share with the other women at the retreat. I have them write out their story of what brought them to the retreat, and I include guided meditations and ideas for self-care at the retreat. These women are transformed and forever friends at the end of this retreat. Kylie finds the most healing and safe locations around the world, typically yoga retreat destinations. To find out more about Kylie Hanish, visit her website at www.returntozerohealingcenter.com. This was the photography resource I mentioned earlier in the presentation, Now I Lay Me Down to Sleep. It might be in your area. I'm in Los Angeles. This is another bereavement photography resource, Nesting Instincts. My office is located in Los Angeles, and in Los Angeles there's an area called Santa Monica, and I facilitate several support groups here out of my office. The Miss Foundation is another great resource to find support, not only in Los Angeles, but I believe nationally. There are Dopplers available for free for people who become pregnant after any type of loss. It's called Tiny Heartbeats. There's also Count the Kicks. There's an app available for subsequent pregnancies or any pregnancy. It helps keep track of your baby's kicking. These are bereavement support items. Molly Bears provides a bear, the weight of your baby when it was born. And then the Pink Contessa does that as well. But Molly Bears, I think, is really back-ordered at the moment. Try Etsy. Etsy is a wonderful resource for bereavement jewelry and memorabilia. Online support, Grieving Dads, Unspoken Grief, Still Standing, Caring Bridge. Caring Bridge is a nice resource to use to create an online place to share information while you're in the hospital or where your client or patient might be in the hospital to stay up to date on what's happening. Stories of Babies Born Still. Members are encouraged to share photos, memories, feelings, blogs, and artwork. And there's something else called Share, which provides in-person peer support and resources for families experiencing the death of a baby. And here are some nice book recommendations. There are many more on Amazon to choose from. These tend to be the ones I go to. Thank you again. Please check out the other presentations I offer on my website, www.drivylove.com. Namaste.
Hi, Dr. Ivy Love here again with you. I wanted to thank you for watching my presentation on the grief and trauma of stillbirth and infant death. If you would like to learn more about my work and how I incorporate ritual, guided meditation, energy healing, and other tools to help women integrate their grief and find hope and healing moving forward in their lives, please contact me to schedule a time for a consultation either through my website at drivylove.com or call me at 310-828-7530. Namaste, and thank you again in gratitude.